Hello, my name is Zina, and I'm going to be doing the drawing the insulin skills video today. I'm going to start off by verifying the healthcare provider's orders. I will verify the six rights of medication administration, which is the right patient, drug, dose, time, route, and documentation. Then I'll check the medication order in the EHR. For this patient, the doctor has ordered 4 units of regular insulin sub Q and 8 units of NPH sub Q every morning before breakfast time. I'm going to close the door to ensure patient privacy. I will introduce myself to my patient, and then I will go ahead and ask for 2 patient identifiers. And I will go ahead and check with my patient's wristband to make sure that I have the correct patient. I will then ask my patient if they have any known allergies, such as food, medication, or seasonal. Then I will perform hand hygiene and I will apply my clean gloves. Okay, Mr. Smith, your doctor has ordered 2 different types of insulin for you today. Insulin is a hormone that regulates blood glucose levels in diabetic patients. It facilitates the movement of glucose from your blood to your cells for energy. The first type is regular insulin, and it has a faster onset but a shorter duration. And the second one is NPH, which is an intermediate acting insulin, and it has a delayed onset but a longer duration. Some of the common side effects include hunger, tremors, sweating. You might feel a slight pain on the injection site, and some of the more serious side effects can include seizures, headaches, and confusion. If at any point you experience any of these, please make sure that you notify us immediately. You may also feel slight burning or stinging sensation when I'm administering the injection. Okay, do you have any questions for me? Okay, so my patient's blood glucose level is currently 110. Mr. Smith, to let you know, we will bring you a breakfast tray 30 minutes after administering this injection. Okay, I will proceed with verifying the orders with the MAR, and I will make sure to calculate the total volume of insulin, which will be 4 units of regular insulin and 8 units of NPH, which will give us 12 units total. I will have an RN verify the next steps with me. Okay, so then once I have that, I will go ahead and roll my vials of medication, and this is to resuspend the meds. And then this will allow for it to go back to room temperature. I will then go ahead and wipe off both of the top of the vials with alcohol swabs. And then I will go ahead and grab my 1 milliliter syringe, make sure that I have the correct one. And I will go ahead and pull back my plunger, 8 units of air. Okay, once I have 8 units of air, I am going to go ahead and inject these 8 units of air into my NPH vial, making sure that I do not touch the medication with the tip of the needle. Okay, then I will release the air into the vial. Then I will remove. I will go ahead and withdraw 4 units of air. And these 4 units of air, I am going to go ahead and release into my regular insulin vial. Once I do that, I'm going to go ahead and withdraw my 4 units of my regular insulin. Okay, so I went ahead and withdrew the 4 units of regular insulin. I will check for any air bubbles. Make sure that if I see any air bubbles, I go ahead and tap on my syringe. I will then go ahead and check with my EHR or MAR and have the nurse that is by my side verify that I withdrew the correct amount of regular insulin. Now, once I do that, I'm going to go ahead and withdraw 8 units of my NPH. And I am going to make sure that I add the 8 units to the four that I already have in my syringe, which will bring me to a total of 12 units. So now I'm going to go ahead and withdraw 8 units of NPH. And I have to make sure that I am careful that I do not withdraw any more than I should. Okay, 12 units. Same, if I see any air bubbles, I will go ahead and tap on my syringe. And then I will show this to the RN next to me, make sure that she verifies that I withdrew the correct amount. And then I will recheck against the EHR or MAR one more time. And then I will go ahead and recap my needle and make sure that I have the 12 units withdrawn. Once I do that, I am going to go ahead and administer my patient with their medication. If I happen to prepare the insulin away from the patient's bedside, I need to make sure that I label the syringe with the name and the dose.